Hi my friends, my name is Dr. Sayyeda Amna Mahmood. So I select today the topic about the scan techniques. So what is we have to use to the first in ultrasound in the plane, how which we are using the plane in ultrasound. So now let's start to see for about the plane, just a brief description. So we have four planes as you remember your anatomy. So the median plane is a divided body on equal part on the right and left portion. Sagittal plane or longitudinal plane are the same name, which is divided on the sides of the body from unequal but the right and left. The transverse, the body is divided is unequal, superior or inferior, and the coronal plane, the body is divided on unequal to interior and posterior. That I will be discussing more. So now I just discuss this picture which you have to easily understand about the plane. The four planes, first you have see this corner. So 1, 2, 3, 4. So the red one we have discussed is equally divided to the body in the center. So this is called the median plane. And the transverse plane this is the transverse plane which is divided the body from superior to inferior. Any side like here superior, inferior, this is called as the transverse plane. Sagittal plane first we have to discuss. The sagittal plane is divided the same as like the median plane but unequal side from the left to right. And now we have discussed about the coronal plane, which is very important, which is divided from here to there from the sides, which is divided from the sides from the interior and posterior. So we have to see the coronal plane. Now let's start to discuss about the probe. So always remember the cursor of the probe. This cursor of the probe is on your fronts is mean in when you are holding the probe cursor facing directly away from you. Okay, and then we have decided the left and right from your side and the interior and posterior. If the cursor is back, this means your direction is opposite way. So the left is here, then right is here, and that is posterior and that is interior. You have to remember this thing. So always check when you are holding the cursor, you check the cursor, where is the cursor side, where is the probe side. Now let's start to discuss to another thing like the directions with the angle of the probe. Because when we have discussed the Doppler ultrasound, we have the some angles. Like you have to see this is the artery is towards the probe, like is going towards the probe. So blood is showing on the red direction. Like when you apply the color and it making the angle with the probe. But in the middle, you have seen there is no color. So it is bit parallel to the probe. So it is showing no angle. Remember that. And then away from the probe is always with the color showing the blue. This is the body or the blood movements to the two relationship of the probe, which we have discussed in the Doppler. Then it is a small brief description here, because we have to see the angles with the probe. When you holding the probe, they have the different directions. So when you have take the probe from the transfer direction, so this is if your cursor is here, so it means it is right, it is left, this is interior and the back is posterior. So always remember the cursor side relationship and then the angles. Now how do we have to rock the probe? So rock the probe is very important. As I told you here, this is a cursor or we call as a notch. So this is the rocking of the probe. So we have sliding, like to slide on the skin. We have rotate from the left to right, up and down, interior, posterior. And then we have tackling, like we have slightly up the probe and slightly press the probe. It's called the tackling. And rocking means you have to be just on the another side is deep and the other side are towards you, is just on the slightly up. This is called as a rocking, but the mostly it is used in the cardiac echocardiography. So we are not using this rocking and the tackling, we are using the sliding and the rotation. So this is, remember, this is we are doing in abdomen, pelvis, and thyroid, breast, ultrasound, the same technique. Thank you so much.